Hello CNAs, this is Kayla, your RCC Assistant DNS, and I want to talk today about documenting the level of assistance required for personal hygiene. We've got our mock resident Anita Bath here, who needs some help. So let's start with the heaviest level of assistance, which is total dependent. And so for total dependent personal hygiene, it would be a patient who is maybe unable to move their upper extremities and they need you to hold that wash rag, wash their face, brush their teeth, shave them, apply makeup. They're unable to participate at all. Typically for personal hygiene, this is going to be one-person assistance, but it might take two depending on how extensive the hygiene is. The next level of assistance is extensive, which means that you're providing any weight-bearing assistance at all. If it's someone with limited shoulder mobility and they're not able to reach their arm up high enough to brush their hair, so they might have brushed their teeth on their own, but you're physically lifting the brush and brushing their hair, that's going to be extensive assistance. You're having to weight bear for them. And that's typically going to be a one-person assist. For limited assistance, there are very, very few examples for personal hygiene. One might be that they are blind and you guide their hand to where the hairbrush is on the tray, so you are not weight bearing, but you're guiding their hand to their hairbrush, their toothbrush, letting them know how you've set up the tray table, but it's not providing any lifting assistance. You just set it up and provided guided maneuvering of limbs. Supervision is someone who would choose to sit at the sink and do their personal hygiene, but they need to be watched while they're up in that chair. So you're supervising them and you might be cueing them that, make sure you rinse your mouth out or make sure that you brush both sides, but you're not actually providing any hands-on assistance. Independent is someone who is either being set up, so you've set up their tray table, you've brought everything in, but you're not actually having to do any assistance. They're able to do 100%, you come back and clean it up later. Or it's someone who needs no physical assistance at all. So they've gotten themselves out of bed, they've gone over to the sink and they're brushing their teeth, and you didn't have to participate in this ADL at all. Residents will refuse to brush their teeth, to wash their hair, to be shaved, and it is okay to document resident refused as long as the floor nurse who is caring for the resident has been notified. We need to make sure that we're offering multiple times. It's a part of their dignity. They need to be offered to have their teeth brushed. They need to be offered to have their hair brushed. You also might document resident not available if they're out to an appointment for your shift. It is unlikely that you are going to ever need to document not applicable. All people need hygiene, and it's always going to be applicable. Okay, thank you.